My name is Alicia Delgado and I'm a student nurse practitioner, and today I'm going to be performing a head-to-toe assessment. Do I have permission to video for the head?
Yes.
Okay. So the first thing I'm going to do is I'm going to assess the skin of the face, and I'm looking to see if the color is normal for ethnicity, which it is. I'm seeing that there's no bruising, masses, nodules, lesions, or scars. I'm not noting any erythema. There's no swelling. I'm going to lightly touch, and temperature is warm, texture is smooth, skin turgor bounces back appropriately, and then I'm also making sure that I'm not seeing any like abnormal areas that might be sticking out versus not. Next, I'm going to be looking at the head as a whole. It's normal for size, symmetrical, and midline. I'm assessing the head, and I'm feeling for any nodules and masses, which I don't feel. I'm looking at the hair, and I'm not seeing any abnormal patches of baldness. I'm also inspecting to make sure that there's no any infestations, and I'm not seeing that. I'm also making sure that there's no areas of the skull that are indented. Everything feels nice and smooth and structurally sound. Next thing I'm going to do is I am going to palpate your temporal area. So is there any tenderness?
No.
Excellent. And I'm going to start palpating your lymph nodes. These are the pre-auricular, post-auricular, occipital in the back of the head, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and then supraclavicular. And I'm not feeling any nodules, any swollen lymph nodes. The next thing that I'm going to do is I'm going to move on to try testing two cranial nerves, cranial nerve number 5. I'm going to have you, as the trigeminal nerve, clench your jaw. Perfect. And I'm going to have you close your eyes, and I'm testing light touch. Do you feel me?
Forehead, left cheek, right cheek, nose.
Perfect. So cranial nerve, trigeminal nerve is intact. We're going to look at 7, the facial nerve. I'm going to have you smile, frown, puff your lips out, raise your eyebrows, close your eyes touch, and then pull out your cheeks. And I'm looking for symmetry, and everything is symmetrical except for when he puffs his cheeks out. The left cheek doesn't puff out, but this is a well-known established that he's told me about from a previous episode of Bell's palsy, and it's never recovered. Now I'm going to go off and inspect the ears. So I'm looking again on both ears, and I'm seeing that the size is normal in the placement. I'm looking to see if there's any abnormalities with color, swelling, any nodules or masses that I'm seeing, any foreign bodies. I'm not seeing any. I'm also going to be inspecting the mastoid on both sides, and I'm not seeing any discoloration or swelling. I'm going to be palpating it. Any tenderness?
No.
And I'm going to percuss. Okay, excellent. And now I'm going to test cranial number 8, the vestibular cochlear nerve. So I'm going to have you occlude one ear for me, and I'm going to whisper a word.
Apple.
Okay, and I'm going to have you occlude the other side.
Banana.
Perfect. So that nerve is intact. The next one that I'm going to assess is called a Weber and Orion test, and this will test for conductive hearing loss and sensorineural loss. So the first one I'm going to do is Weber, which checks lateralization. And let me know if you hear anything at all on both sides, just one side.
Both sides.
Perfect. And then I'm going to do this as well. This is going to be the Ryan's test, and I'm going to put this on the bony prominence behind your ears. I'm going to start with one side and just tell me when you stop hearing the sound.
I don't hear the sound.
Do you hear it now?
Yes.
Perfect. And I'm going to do it on the other side.
I don't hear it.
And do you hear it?
Yes.
Perfect. So that says that hears the air conduction more than the bone, which is normal finding. So that says that its hearing it overall is intact. Now I'm going to inspect the ears using my otoscope with the light. And I'm just going to look at the structures within the ear and kind of look into the canal at a distance. And I'm looking to see, you know, color. I'm looking to see, is there any excess drainage at all? Is there any foreign bodies that I'm seeing? Any redness? And I'm not seeing any of that in this side, so I'm going to look on the other side. And I'm not seeing that. And now I'm going to look a little bit closer into the ear canal. And I do see a lot of earwax and redness within the canal. A closer look at the tympanic membrane. It's pearly gray. I'm not seeing any fluid behind the ear or any perforation. The cone of light on the left side was at 7 o'clock, which is normal. I'm now going to look at this side. And this one, the ear canal, there's no earwax. It's normal color. Tympanic membrane isn't bulging. It's pearly gray, and the cone of light is at 5 o'clock, which is normal. Okay, so that pretty much does the ear assessment. So now I'm going to move on to the eyes. And for inspection, I'm looking at eyebrows. I'm looking at the eyelashes. I'm not, again, they're both symmetrical. I'm not seeing patches of hair that's not there. I'm looking at his sclera, which is nice and white. I'm going to look at the inner eye. I'm just going to look down at the conjunctiva, which is nice and pink. I'm not seeing any drainage, crusting, any signs that there might be an inflammatory process going on with the eyes. Both eyes are moving normally with me. And now I'm going to move on to testing the optic nerve, cranial nerve number 2. So we're going to start with sight. So I'm going to use the Snellen chart, and I'm going to have you occlude one eye. And I'd like you to read the smallest line for me.
DEF POTEC.
Perfect. I'm going to have you cover the other eye and do the same thing.
DEF POTEC.
Perfect. So that was 20/20 on the Snellen chart. So, you know, visual acuity is intact. Now I'm going to do the visual fields. So while you're looking at me, I'm going to be making a number with my fingers, and you just tell me what number you see in your peripheral vision.
3, 4, 5, 1.
Perfect. So optic 2 nerve is intact, and now we're going to do ocular motor nerve, which is the cranial nerve number 3. And I'm going to switch off my light here. So I'm going to have you look ahead, straight ahead, and I'm going to be shining a light, and it's going to go to the side of your eye. And I'm going to be looking at your pupils. Okay, and both pupils constricted with direct light, and when I was putting the light on one side, the opposite eye concentric also constricted, so that's normal. Now I'm gonna test the ocular nerve, ocular motor nerve, the trochlear nerve, and the abducens nerve. And this is going to be mostly with eye movements, so I'm going to have you keep your head still and follow my finger with your eye. And I'm looking for any abnormal eye movements like nystagmus, where the eyes kind of shift side to side. I'm not seeing that, which is great. So the eyes were able to move. I'm gonna have you focus on my finger and then look very far away. And the eyes dilated when looking far away and constricted when looking closer up, so that's also normal. I think that concludes the ocular abducens and trochlear cranial nerves. So the next one that I'm gonna have to do is I'm gonna look closer at your eye, and I'm gonna be looking to make sure your arteries look normal, veins. I'm going to be looking at the optic disc, making sure that it's not blurry. I'm going to be looking for a red reflex. I'll do that first. So just look straight ahead. And I see a red reflex there. And red reflex there. I'm going to get really close. Just look ahead. And I'm not seeing any cotton wool bodies. I can see arteries. And the optic disc is not blurry, which is great. I'm doing the same thing. I can see the optic disc. It's not blurry. I'm seeing the arteries. And I'm not really seeing anything abnormal there. So the next part of the assessment that I'm going to do is I'm going to be looking at your nose. So I'm looking just upon inspection, just seeing that it's midline, it's symmetrical. I'm not seeing anything abnormal with your nose. I'm looking to see if there's any drainage that's coming. I'm not seeing that. I'm going to take a closer look inside of your nose. And I'm not seeing any drainage, but I am seeing redness. I'm not seeing any polyps. I can see the turbinates, and those are there. And again, I'm not seeing any polyps on this side. There is redness, a little bit of swelling, but the turbinates are there. The septum is midline. I'm not seeing any deviation. For the nose, I'm going to check the olfactory nerve. So if you can occlude one nostril, just check for patency. And that one's a little bit, well, patency is not full there, but there was some swelling and redness that I did see, but there is some movement of air. Another way to also test the olfactory nerve is for smell, where I would take a scent and have them occlude and identify the smell, and then do that on the other side as well. The next thing that I'm going to assess is your throat and your mouth. So I'm looking at the lips. They're pink, moist. I'm not seeing any discoloration. I'm going to have you just kind of pull your lip down and then pull the top lip. And I'm going to use the light here. I'm just going to look in. And then I'm also going to have you lift up your tongue. I'm looking at the cheeks, and I'm looking for any white patches, anything that would indicate there's something abnormal, area of concern, or any red areas or any bleeding. I'm not seeing any of that. Dentition looks good. I'm going to have you Throat is a little red. Tonsils are about +3 plus. They're almost touching the uvula, the soft palate, and uvula raised as when he went which is the or the glossopharyngeal and the vagus nerve are intact when doing that. Tongue was normal pink color. I didn't see any white or anything that would indicate maybe a fungal infection. Salivary glands were there. So, you know, the uvula was midline. I didn't see it deviated it to a side. So far, your mouth looks normal. I'm going to have you stick your tongue out, and that's nice and midline. It's not deviated to one side, so put it side to side for me. Perfect. And so that's testing the hypoglossal nerve, which is intact. Now I'm inspecting the neck, and again, I'm just looking at color as normal. I'm looking, there's no obvious signs of bruises, lesions, nodules, masses, scars. I'm not seeing any swelling. Again, the temperature is warm, texture is nice and smooth. Skin turgor is, the skin bounces right back, it's not tenting. Again, no swelling. The trachea is midline, it feels midline. I am palpating, I can feel the thyroid gland anteriorly. I'm also gonna go behind to palpate the thyroid. Okay, I'm gonna have you swallow. Perfect. And again, when I was palpating the thyroid, I didn't feel any like hard bumps. It didn't feel enlarged. It felt normal. I didn't feel any goiter. And now I'm going to palpate the carotid artery one at a time. Two plus, so normal. And now I'm going to listen for any bruits using the bell of my stethoscope. Okay, I'm going to have to hold your breath. No bruits, you can breathe. And then I'm going to just test the range of motion. So I'm going to have you put your chin to chest, lift back up, hyperextend, and then go side to side, and then rotate it all around. Full range of motion in the neck. Any discomfort while you were doing that?
No.
Great. Now I'm going to have you shrug your shoulders up against the resistance, and that's the accessory nerve is intact. The next thing I'm going to do is a lung assessment. So I'm going to have you turn your back away from, so it's like facing me, and perfect. And I'm going to lift the shirt up. And when inspecting the back, again, I'm looking at color. It's normal for ethnicity. I'm not seeing any bruises, scars, lesions, nodules, masses. It's warm, smooth. Skin turgor is good, no swelling. Also overall looking at, structurally, I'm not seeing any signs or symptoms of respiratory distress. I'm not seeing any use of accessory muscles. He's not sitting in a tripod position. There was no nasal flaring or retractions. I'm not seeing any discoloration of the skin. There's no blue or cyanotic aspect. I'm not seeing any deformities, like there's no ribs that are protruding out on one side versus the other. So far inspection is normal for the posterior chest. The next thing I'm going to do is I'm going to start palpating structurally. I'm going to feel along the spine, make sure it's nice and midline. I'm not feeling any protrusions. Feel the scapula. Or any herniated discs. Muscles, I'm not feeling any swelling in the muscles. No area that's warmer than the other. And so now I'm also just in general inspecting just how he's breathing. It's nice and relaxed. a regular rate and rhythm. Depth is normal. He's not, going really, he's not working hard to breathe. I'm not seeing any shortness of breath. I'm not hearing any wheezing without even using my stethoscope. Looking at the way he's breathing and the chest is symmetrical. I'm going to palpate for symmetry, so I'm going to have you take a nice deep breath in. Okay, my hands moved in and out equal on both sides. The next thing that I'm going to do is I'm going to feel for tactile firmitus, which is like vibration. So I'm going to have you start saying 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. And that was normal vibration on both sides were equal. And now I'm going to percuss, starting at the apices. Okay, and now I'm also going to percuss the diaphragmic excursion, which basically sees how much the diaphragm moves up and down. So I'm gonna have you take a nice deep breath in, and when you fully exhale, I'm gonna have you hold that. Okay, and I heard dullness. I'm going to stop here. You can breathe normal. And then when you're ready, take a nice deep breath and hold it in. Okay, you can breathe and relax. So that's about, I'd say about 5, 6 centimeters, which is normal. So now that I have done through the percussion, went through the lung fields, I did the, to see how much the diaphragm moved up and down, I'm going to actually start to auscultate and listen to the lung sounds. Okay, breathe in and out. In through the nose and out through the mouth. And I didn't hear any abnormal breath sounds. And now I'm going to listen to see, I'm going to do a couple breathing tests that would assess for consolidation or fluid in the lungs. So I'm going to have you say the letter E every time you feel my stethoscope.
E, 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 E.
Perfect. And now I'm listening to see if the E sounds like an ah, but it sounded E throughout, and that's egophony. Now I'm going to do another one where I'm going to do the same thing every time you feel my stethoscope. I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. This is bronchophony, and this I should hear it being very muffled and distant, and which it did. An abnormal finding would be if I heard it nice and clear, which would indicate that there is some fluid or consolidation process happening. The last one I'm going to do is you're going to whisper 99. Okay, and I didn't hear it at all throughout, which is normal. If I could hear it nice and loud and clear, that would also mean consolidation or some type of fluid within the lungs, so that would not be abnormal. Last I'm going to do posteriorly is test for CVA tenderness. And any tenderness when I did that?
None whatsoever.
You also did not move with that, which would also indicate there was, so no tenderness noted. I'm going to have you turn towards me. And then we're going to inspect the anterior chest. Okay, and I'm looking at color, which is normal for ethnicity. I'm not seeing any bruising, nodules, masses, lesions, scars. The temperature is warm, texture is nice and smooth. I'm not seeing any swelling. Skin turgor is good, it bounces back. Again, I'm not seeing any obvious signs where one side of the chest is depressed versus the other. Everything is symmetrical. The next thing I'm going to do is I'm going to palpate for equal expansion. And my hands moved nice and equal on both sides, which was normal. I'm going to palpate the tactile fremitus again, so say 99.
99, 99, 99, 99, 99, 99.
Perfect, and the vibrations were equal on the same sides. And now I'm going to auscultate. This is the right anterior lobe and the lateral side. And lateral on this side. Perfect. So lungs were nice and clear to auscultation. Now I'm going to move on to the cardiac sound. So I'm going to just point out the different cardiac signs. So we have the aortic, then we have pulmonic, Erb's point, tricuspid, and then the mitral. So I'm going to listen with both my diaphragm and the bell of my stethoscope. Perfect. And then the bell of my stethoscope. Again, aortic, pulmonic, tricuspid, and mitral. I also forgot to mention that for respiration rate, it was 14, and I counted that earlier, but I don't like to let the patient know when I do respiration counts because then it's not accurate. For point of maximal impulse, PMI, that's again 5th intercostal space midclavicular line, so it's right here. And I'm also just palpating it to make sure it's not displaced, because that would indicate maybe there's an enlarged heart. And now I'm going to listen to the apical pulse. For a full minute. Okay, and that was around like 64 beats per minute, rhythmically, regular rate and rhythm. Okay. And then for the next, I'm gonna have you lay down on the couch for me on your back. And I'm gonna be assessing for any lifts or heaves. Which I don't see. Now I'm going to palpate for any thrills and all the palpation points. And I'm not feeling any thrills. Now I'm going to listen to the same spots that we did before. So the aortic, pulmonic, tricuspid, and the mitral. And that was with the diaphragm, and I'm going to switch over to the bell. And the bell can sometimes pick up on murmurs, and I'm not hearing any. Now to further assess for other abnormalities within the heart, for mitral stenosis, I'm going to have you lay on your left side. And using the bell of my stethoscope, I'm going to listen. And I'm not hearing any murmur. I'm going to have you sit up. And using the diaphragm, I'm going to see if I can identify, and hopefully not, aortic regurgitation. So I'm going to lean forward and hold your breath. Okay, and I don't hear anything. Sounds normal. Okay, so the next we're gonna move on to the abdomen assessment. So I'm gonna have you lay back flat again. Okay. Okay, so so again, I'm first just looking at the abdomen. I'm inspecting the skin. I'm looking for color, which is normal for ethnicity. I'm looking at to see if there's any, I don't see any masses, nodules, lesions, scars, any swelling. The texture is nice and smooth. Temperature is nice and warm. It's nice and dry for moisture. Skin turgor is good. I'm not seeing any areas of the abdomen that's like more swollen than the other. No distension, nice and soft. That's flat. And then next I'm going to auscultate for any bruise. Oh, and it's nice and symmetrical. So I'm gonna have you hold the camera for me. While I do this, I'm gonna use the bell of my stethoscope. The aorta. And I shouldn't hear anything, which I don't. And the renal on both sides. And the iliac. And the femoral. And I hear no bruise. So now I'm going to listen to all 4 quadrants. And I'm hearing sounds, but not hyperactive. They're all normal active. And now I'm going to start palpating for tenderness. I'm going to start with light. Any tenderness? I'm not seeing any guarding. And then I'm going to go deeper. And I'm not feeling any masses. No tenderness for you?
None whatsoever.
Perfect. Now I'm going to palpate, and I'll help you rest your arms. I'm going to palpate your liver. So I'm going to put my hand over here on the right upper side here where the rib, end of the ribs are. And I'm going to have you take a nice deep breath in and out. You can feel it coming down, and I'm feeling, and it's nice and smooth. And I can feel the edges, but I'm not feeling any rough edges. The next thing I'm going to do is I'm going to estimate the span at the MCL. So I'm just going for the liver. So I'm going to have you hold this while I kind of percuss for the dullness. So I'm getting right about here, which is probably about like 5 centimeters. The next thing that I'm going to do is I'm going to see if I can palpate the spleen. So again, I'm going to have you take a deep breath in and then out. And I'm not feeling anything, which is good. If I could feel the spleen, that meant it's like 2 to 3 times larger, and that's not a good finding. That would be abnormal, and we would be concerned. The next thing I'm going to do is see if I can palpate for the aorta pulsation. So I'm going to push on each side here, and basically this helps me assess if there's like an aneurysm. And I'm not feeling that, so that's good. I can feel the pulsation, nothing like. And the next thing I'm going to do is I'm going to palpate lymph nodes, inguinal and femoral. And I'm not feeling any swollen lymph nodes. The next thing that I'm going to do is I'm going to percuss in all 4 quadrants. Tympanic in all 4 quadrants. The next thing that I'm going to do is I'm going to see if I can see any splenic dullness starting from the left mid-axillary area. And again, this is to see if there's, if I'm checking for the spleen. And I'm not picking up on any dullness, which is good. The next thing that I'm going to do is I'm going to, and this is called the Traub's space. The next thing I'm going to do is I'm going to perform a Murphy sign, which would tell us if there was any issues potentially with the gallbladder. So I'm going to start with the right upper quadrant, and I want you to take a deep breath in. And as I was pushing, there was no guarding or pain, so that tells me that's a negative Murphy sign. So that's good. Maybe there's no cholecystitis going on or any issues with the gallbladder. The next thing I'm going to do is I'm going to show you some areas that would help indicate that there might be an appendicitis happening. So the first would be just showing you McBurney's point, which is about 1/3 way from the anterior superior iliac crest, which is basically the hip, to the belly button. So like about a third, like right here. So if you push down here, and there was any tenderness, then that would be indicative of that. I'm sorry, it would be this side. Any tenderness?
No.
And then we can test for rebound, where you push in and pull right away. Any tenderness there?
No.
Excellent. And then we're gonna see it's called psoas, which is the right lower quadrant pain, and this would happen when I have the patient lift the right thigh as I push down. So lift your thigh. Any pain? Excellent. The next one we're gonna do is called so yeah, this was the 1/3 of the way was McBurney's point, right on the right lower quadrant. The left side, if I push in, is Roussefing's side. Roussefing's sign. So if I push down in the left lower quadrant and you had pain on the right side, that would indicate appendicitis. So Roussefing's sign, no pain?
No.
Excellent. Okay, and then the last one is called obturator sign, and this one is again would indicate right pain if I have the hip flex and turn. So I'm gonna have you bend your knee here, and I'm gonna kind of rotate it. Any pain?
No.
Okay, excellent. So that would be a good, another indicator that there is no appendicitis happening here. Okay, so the next we're gonna start doing is we're gonna go back over here, and we can start doing the upper extremities. Okay, so now I'm going to assess. I'm gonna inspect. I'm gonna just have you back up just a little bit for me. Perfect. I'm going to inspect and palpate the joints of your hands and fingers, and let me know if you feel any tenderness as I'm doing this or any pain. I'm basically feeling for any swelling, any joints that are bigger than the others, any deformities of the fingers, warmth, am I feeling any crepitus as I'm doing this, and is it symmetrical? And the hands and joints look symmetrical, and you said you had no tenderness as I was doing this?
None whatsoever.
Okay, great. I'm also going to check the circulation by checking your capillary refill in your fingers by pushing down and blanching and seeing how quickly the blood returns. And it's all less than 3 seconds, which is great. I'm also going to check your radial pulse on both sides. I'm making sure that it's nice and equal, not bounding, but normal. So 2+ and equal on both sides. Overall, for the upper extremities, nice and warm for temperature. Skin is nice and dry, or not excessively dry, but and I'm not, and the skin integrity looks good. Skin turgor's good. Again, I'm not seeing any bruising, scars. Any one arm is not more swollen than the other. It's symmetrical. Overall, the skin is intact and looks good. The next thing I'm going to do is I'm going to look at the range of motion of your fingers. So I'm going to have you flex and extend, and then hyperextend, and then abduct, which is have them go away, and then adduct, put them together. And then I'm going to have you touch your thumb to each finger. Perfect. I'm going to have you squeeze my fingers tighter, 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 tighter. Equal. Strength is 5 out of 5. Excellent. I'm going to look at your wrists and inspect them. And again, I'm not seeing any swelling. I'm looking under any tenderness.
None.
Excellent. So I'm going to have you flex, extend, hyperextend, side, side to side. This would be ulnar deviation, radial deviation, and then rotate, full range of motion of the wrists, which is great. Now I'm going to look at your elbows. Excellent. I'm going to look at the other one. They look symmetrical to me. Any tenderness?
None.
Okay, I'm going to have you go like this. And then go like the, so flex and extend. I'm going to have you pull against me with perfect push. Okay, 5 out of 5 strength for the elbows. And then I'm going to, I think we're going to look at the shoulders. So again, I'm looking to see that they're symmetrical. I'm not seeing any swelling. Any tenderness with your shoulders when I'm touching?
Nope.
Okay, and then I'm going to have you push out against my hands with your arms. Perfect. Push in. Excellent. 5 out of 5 strength. I'm going to have you flex by going like this with one, then the other, and then out like this. Or I'm sorry, in front of you. I shouldn't. And then behind you, and then hyperextend behind. And then rotate and make circles. Perfect. So full range of motion of shoulders. And then next we'll go to I think the spine would be next. So I'm gonna have you turn around for me. Again, inspecting the spine, I'm going to have you bend forward, and I'm looking to see that it's nice and even. It's a good way to see for scoliosis. I'm not seeing that that one shoulder is above the other. It's nice and equal to me. I'm not seeing any abnormal curvatures along the spine, and he's able to bend it forward. I'm going to have you stand up and then bend your back. Perfect. I have you go side to side for me. Perfect. And then the next thing I'm going to have you do is we're going to see about maybe hips. So I'm going to have you put your leg out like this, and then behind you. I'm going to have you do the other one. Perfect. Okay. The next thing I'm going to do is I'm going to use my to test for like vibration for the upper extremities, which so I'm going to tell me if you feel vibration.
Mm-hmm.
Perfect. I'm going to do the other one.
Mm-hmm.
You feel vibration?
Yep.
Excellent. So then the next thing I'm going to do is, now that we did range of motion in the arms, and like in the upper extremities, I did skip ahead and do a little bit for the legs, but I'm also now going to just do some light touch sensation. So we did vibration for the upper extremities, and now we're going to do light touch. So I'm going to have you close your eyes and let me tell me if you feel me which arm I'm touching.
Right arm. Left arm.
Perfect. So that's intact. And now I'm going to test your cerebellar coordination. So I'm going to have you take your hands and you're going to place them. See if I can get this better. Place them on your lap like this, and you're going to flip them back and forth rapidly. Perfect. The next thing that I'm going to have you do is I'm going to have you do serial finger opposition. So you're gonna go like this. I know we did this earlier, but perfect. And then the next thing I'm gonna have you do, and I probably put this back. Is you're gonna touch your nose and then touch my finger with your finger. Keep doing it. And then do it with your other hand. Perfect. Okay, so that's intact. The next thing I'm going to do is I'm going to put a random object in your hand. I'm going to have you close your eyes, and I'm going to put a random object in your hand, and I want you to be able to identify them without peeking. Okay, so we'll do the first one.
Nail clippers.
Perfect.
Television remote. The television remote. Nail clippers.
Perfect. So that was able to test what's the word? Stereognosis. Stereognosis. Now I'm going to have you close your eyes, and I'm going to draw a number in your hand, and I want you to, as best as you possibly can, see what number that I'm going to draw.
3.
Perfect.
5.
Perfect. And now I'm going to do the other hand.
7.
Okay, perfect.
1.
Perfect. And so that's called graphesthesia, and so that's intact. The next thing I'm going to do is I'm going to do the reflexes. So I'm going to use my hammer. So I'm going to do the brachioradialis first. So I'll see if I can rest. Perfect, and the hand flicking, but I also saw the muscle tense up over here. So that one was intact, so now I'm going to do the next one. And that's intact. And now I'm going to do the bicep tendon. And that, I was looking at the muscle which activated, and now I'm going to do this one. And the muscle activated, so I know that that one's intact. Next what I'm going to do is the triceps, so I'm going to have you try as best as you can, relax your arm, and let me hold the weight. And that one moves there, and then I'm going to do this side. And that one was intact. And the next I'm going to do is the patellar. Let's see, what would be, maybe have you go in the, just maybe a little bit higher. Okay. And those reflexes were intact. I'm going to have you cross your leg. Perfect. I'm going to do the, let me see if I can. Achilles. Perfect. I'm going to have you cross the other one. Excellent. And then the next one I'm going to do is the Babinski. And so I'm going to basically draw with the end of my hammer on the bottom of your foot. And the toes moved inward versus abnormal as if the toes extended out. So I'm going to see your other. And again, the toes moved in versus out. So that's normal. Toes moved out, that would not be a normal finding. The next part of the assessment that I'm going to do is I'm going to just look at so I'm going to have you put your foot up. Actually, perfect. So I'm feeling I'm inspecting the toes. All look like normal for color. I'm looking again for any redness, swelling, any bruising, nodules, lesions, masses. I'm not seeing any of that. Temperature is normal. Is there any tenderness? I know, I'm sorry, I'm a sucker I'm guilty for always tickling. I'm gonna have you kind of extend and flex your toes, try to spread them out, put them close together. I'm going to have you do that with your other foot for me. Again, I did the same thing with inspecting. Okay, so good range of motion for the toes. The next thing I'm going to is I'm going to check the circulation in the toes, the capillary refill. So again, I'm blanching the toes. All less than 3 seconds. Let me see your other foot. Less than 3 seconds. And now I'm going to check the pulses. So the pedal pulses, which is on the top of the foot, the dorsal aspect. And it's a nice +2 pulse. And then the next pulse I'm going to do is the tibial pulse. Which is there. I'm going to do the next one. And they're equal. Overall, I'm just going to lift the pant legs up here. The color of the skin is normal. Again, I'm not seeing any abnormalities. Temperature is warm, texture is smooth. Skin is dry. Not seeing any varicose veins or one leg is not more swollen than the other. It's equal. So now I'm just going to test range of motion in the ankles. So I'm going to have you dorsiflex, but point down, point up. I'm going to have you rotate your ankles. Excellent. Full range of motion in the ankles. I'm going to have you push against my hands, push down like a brake, 5 out of 5 strength. And now I'm going to have you do your knees. So I'm going to have you, you're already flexed, now extend them. And can you extend further beyond that point? Excellent. And then I'm going to have you push out against my hands. Perfect. Push back, 5 out of 5 strength. And then I'm going to test light touch, so close your eyes and then tell me which leg I'm touching.
Left knee, right knee.
Perfect. And when I was assessing the knee joints, they were both, not one was more swollen than the other. Responded to light touch. I'm going to have you put your foot back on my leg and I'm going to test for vibration for the medial malleolus. You feel that?
Mm-hmm.
Okay, and let me go to the next one. You feel it?
Yes.
Perfect. The next thing that I'm going to assess is hip strength. So I'll have you lay on the couch. Then I'm going to bring this further. Okay. So I'm going to have you push out with your hip to the side. Perfect. And push in. And the same with this one. And in. Okay, 5 out of 5 strength. I'm going to have you externally rotate your hip out with this leg and then with this leg. So like you go like this and then like this. Perfect. And then can you do this one? Perfect. So you have good full range of motion. I know I broke up the hip into two separate parts. The next thing that I'm going to have you do is I'm going to have you stand up for me. And I'm going to have you close your eyes. And basically I'm going to see if you're able to keep your balance. And you are. The next thing I'm going to do is I'm going to have you extend your hands out in front of you and keep your eyes closed. And I'm basically looking to see if one arm eventually drifts down. This is called the pronator drift. And just keep holding that for me. As long as you can, you're doing great. Okay, great. And then I'm going to have you walk towards the door for me so I can assess your gait. And walk back. Excellent. And then I'm going to have you walk on your heels, doing the same thing. Gait is regular, able to walk on heels. And then walk on your toes. And then do heel to toe after. Hop on one foot. Perfect. And then if you can do a deep knee bend for me.
Both feet on the ground?
Mm-hmm. Perfect. Any pain with that?
No.
Okay. And that actually, I think, concludes the full head to toe assessment. Thank you so much.
Thank you.